This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this Sunday morning for Columbus Concerns. Governor DeWine on Friday threw out his schedule, got on an airplane, and started traveling around the state, imploring Ohioans to still be careful when it comes to COVID. He says we're letting our guard down and cases have been surging. In fact, Friday saw the highest number of cases yet since the pandemic began. So we're going to bring you some of the remarks of Governor DeWine this morning on Columbus Concerns.
I know that we do press conferences every Tuesday and Thursday, and you may wonder why I'm doing press conferences today. But I decided to spend today primarily in the western side of the state of Ohio because of the great spread of the virus that we have been seeing in this part of the state. I started this morning and went from home over to Youngstown. They have 3 counties that are clustered that are red over there, and 2 of those counties just went red, so I wanted to talk to the citizens of the Mahoning Valley. But then I spent the rest of the day on the western side, Toledo, Lima, and here. As we look at our top cases, if you list them by the highest incidence of COVID, of the top 12, 10 are in the western side of the state. If you look and look at a map of the western side of the state and go straight down from Williams County, straight down all the way to the Ohio River, double counties, you will see that 12 of those 18 counties are either high incidence and or red. So we have a statewide problem, but we also very, very much have a Western Ohio problem. And it's a Miami Valley problem, it's in the Maumee River area, etc. Today, unfortunately, if we look at it from a statewide point of view, we broke all records, and these are not the records we want. Today we had 1,840 cases, new cases. That is the largest amount, my staff tells me, that we've had since the beginning of the virus. Our positivity numbers that were going down as low as 2.4, I think one night, 2.5. Those positivity numbers, these are statewide numbers, are now up on a daily rate of 3.8 the last day, and the 7-day rolling average is 3.4. So that is clearly going in the wrong direction. Certainly our hospitals are not full. I don't want to in any way tell anyone that, but the number of people being admitted to the hospitals for COVID is in fact going up. I want to talk for a moment about why we are seeing what we're seeing in the western part of Ohio and throughout the state. I want to focus on the western side. I talk every Monday morning, 7:15. I talk to all the health directors in the state of Ohio, so I get a feel from them of what they are seeing. And there's no one reason that we're seeing this spread. There's a lot of reasons, but the best way to summarize it, I think, is that people are simply not being cautious. They're going about their family life and meeting with people. And so we're not seeing masks being worn. We're not seeing the social spread, and we're seeing large groups of people come together. And I don't know about you, but I think that's human nature. I know that when I'm around friends, when I'm around family, I let my guard down. That's what we naturally do. That's what we should do. But this COVID period in our history is just different, and it's looking to spread. And we have to assume that people that we're coming in contact, because many times people do not have symptoms, we have to assume that many times those people have the virus. So I just want to make a plea today. I'm going to go through these numbers in a moment. With the exception of a couple counties in the Miami Valley, all our counties are not good as far as the COVID spread. And we can stop this. We can slow it down. We're going to get a vaccine. I don't know how soon that's going to be, and I don't know how soon it's going to get out. We'll be able to take it out. But we certainly are planning to take that vaccine just as quick as we get it and get it to our most vulnerable people, at the same time give it to our first responders. But we don't know really when that date is going to come, and we don't know how fast we're going to get it. So we've got to learn. I know everybody's tired. I know everybody's exhausted. I'm sick of it. I know everybody else is sick of it. But we have to learn to live with it. And I look at this as a entree to freedom. This allows me, frankly, it'll allow me later today to walk over to see some of our grandkids. Fran and I will. We'll be outside. We'll keep a distance. We'll have masks on. This allows us to do that. It allows us to go shopping. It allows us to go out. It allows us to go to bars. It allows us to go to restaurants. It allows us to do many, many things. But wearing that mask is essential to what we need to be doing. Distance, mask, not large gatherings. And that, frankly, is what we're seeing. We're seeing tragic cases where family members come down with the COVID at a wedding or at a funeral. Tragic cases where people get together as friends in a larger group and they don't distance and they don't wear the mask and somebody gets sick. We're also seeing what we expected to see, and that is when school goes back in, the college is back in, they've been now back in long enough that we're seeing some kids get infected, most of them not having symptoms, many times not having symptoms. Some do, some don't. But then we're seeing this rebound effect where it goes into the next group, and that group may be older. For several months, we saw the age of the people who were coming down with COVID be down. 50% were under the age of 30. What we're now seeing is that age start to creep up. And as that age creeps up, obviously the danger it increases, and the danger of getting sicker because of the age. So those are kind of the trends that we are seeing. We have it within our own power to slow this thing down. And I just want to talk very briefly about some of the numbers in the counties. We'll start with Montgomery County. Montgomery County, has been red, I think 14 out of the last 15. Their numbers, 156 cases per 100,000. And so we track all of these based upon how many cases per 100,000 to level everything off and compare apples to apples. But Montgomery County has been fairly stable. Some of this, of course, has been kicked up from university students. So if you look at Montgomery County, and we look at this every 2 weeks, we go back 2 weeks, 831 cases in the last 2 weeks, 99 people admitted to the hospital from Montgomery County. Mercer County. Mercer County is almost double the rate that Montgomery County is. They're at 286 per 100,000. They've had 118 cases in the last 2 weeks, 14 hospital admissions. Darke County has had some outbreaks in nursing homes. Their number is even higher for this 2 week period. 297, 152 total cases, 10 hospital admissions. Preble County is below the 100 number. So they're at 93, 38 cases, 2 hospital admissions. Shelby County, again, Shelby County is at 193. Shelby County is basically almost 2 times what the CDC says is the high incident rate, so double that. They've had 94 cases in the last 2 weeks. They've had 9 hospital admissions. Miami County, they are over double that rate at 211. They've had 226 cases, 18 hospital admissions. Greene County, my home county, seen a real spike up. They're at 174 per 100,000. The actual number of cases the last 2 weeks has been 295 and 11 hospital admissions. Logan County and Champaign County doing pretty well. They're our lowest in the area. Logan is at 65 per 100,000, and they've had 30 cases in the last 2 weeks. No hospital admissions. Champaign County, they're at 54, so they're about half the total. What 100 would be where you have the high incidence, so they're about half of that. They've had 21 cases in the last 2 weeks. 0 hospital admissions. Clark County has spiked up. Clark County is at 156 per 100,000. There are 210 cases total in the last 2 weeks, 7 hospital admissions. So those are the numbers in the area. We can't get rid of the virus until we get the vaccine, but we can slow this thing down. And so, when I see these numbers and I see what's going on in our part of the state, quite candidly, I'm very, very, very concerned about it. We're to the point in this epidemic when it really is up to all of us what we do in our own personal lives. I truly believe that we can live with this pandemic for a while, we can live with this virus for a while, and that we can do virtually everything we want to do. I know some businesses are still hurting. I know some people are unemployed, and I do not minimize that. But we can continue to try to improve our economy, get more people back to work. But the only way we can do that, is to keep the virus down. We have to keep this virus down. And so it has reached a point where I was very alarmed, very concerned. My obligation, I believe, to the people of the state of Ohio is to share the data, share the information, tell you what we're seeing in each county. If we want to keep our kids in school, if we want to keep them in school, if we want to keep them playing sports, if we want to keep people working, if we want to be able to go out to bars and restaurants and be able to go out shopping or whatever we normally do in our life, if you want to go see your grandkids, we can do all these things. But we can't do it if this thing spikes back up. And we're seeing all the signs that that's where it is headed. When you watch TV at night, you see the hot spots. We have avoided that so far. We've had great tragedies. We've had thousands of people die. We've had people who have had tough time recovering. But we've avoided the overflow of the hospitals. We've avoided in Ohio what we've seen in many other states. We need to keep doing this. I know people are sick of it. As I said, I'm sick of it. But we got to hang in there. We're Ohioans. We can do this. More than happy to open it up for questions.
Governor DeWine, the next 9 weeks are about to start for a lot of schools, and a lot of schools in the Miami Valley are about to return for in-person learning. I mean, at this point, do you think that's safe?
Every school has to make up its own mind. Every parent has to make up their own mind. I think my job is to give the facts and the data as we see it. I believe that our schools in the Miami Valley and across the state have done a good job. I feel that they have made their schools as safe as they can make them. The vast, vast, vast majority of kids in schools, these schools, are wearing masks. They're trying to keep as much distance as they can. They're doing all kinds of innovative things. We're seeing that at the university level, too. They're working very, very hard to do this. So, I think that everybody has to make their own decision based upon what they're seeing out there. I was asked the question this morning in Youngstown. I said, when are you thinking about shutting the state down? And the answer is no. But what's going to happen is, and we're starting to see it already, as the spread goes out, we're starting to see schools shut down for a couple weeks or go remote for a couple weeks. And despite the good job that our educators are doing, if they have widespread COVID in their county, in that school district, there is no way in the world they can keep it out of that school. They can keep kids safe as they can in there So it's up to us. It's up to every one of us. If we want our kids in school, if we want them playing sports, if we want life as we want it to be, we've just got to be careful. And we've got to recognize that it's out there. And it's not a political issue. I know the campaign is coming down the last three. It's not about politics. This is about what we know will work, and it's really basic. So I think that decision has to be made by every school, but I would implore, if you don't have anybody out there, if you have kids in school and you want them to stay in school, wear a mask. If you don't have kids in school, but you care about them, wear a mask, keep your distance. This is how we do it.
Governor, I remember the last time I think that you did something kind of this time of day. I think it was July 15th or somewhere around there, and you had said at the time, I think Ohio's sliding down a dangerous path. That was this summer. Where would you, and this isn't a numbers thing, but where would you kind of rate your level of concern at this point compared to then? Because I think we all remember that.
Yeah, the question is, if you didn't hear it, the question is a very good question. It said you had a speech on July 15th or so, and you said you were concerned. What's your rate of concern at this point? We keep coming to forks in the road, and you got to decide which way you're going to go. I'm concerned. I'm concerned enough that I blew up my schedule for the day and said, hey, I got to get on the road and I got to go out and talk directly to people particularly in the western side of the state of Ohio, because we have a western Ohio problem that's unique. And just look at that map that we put up every week. So I'm concerned. I'm very concerned. We're headed into winter. Great day today. But we know in a month from now it's going to be a lot colder. Maybe next week it's a lot colder. And people are starting to move back in. And we know that it's safer outside than it is inside. And that's a real concern that the scientists have. And look, no one knows what this virus is going to do. I mean, it's impossible to predict it no matter who the scientist is. But the concern is they know inside is more dangerous. And when everybody is inside, so we've got a lot of things coming together. We got schools going back, K through 12. We've got that have been back now for a month or so. We got colleges, the same thing, and then we've got headed into winter. And frankly, what's the other thing? The other thing is we're sick of it. We're sick of wearing masks. We're sick of all this, and I get it, but we got to hang in there for our kids. We got to hang in there for ourselves. We can do this. We can do two things at once, and we got to do it. And the pathway is there. We're going to be able to start getting out the vaccine whenever it's available, and we're going to start turning this thing around. But we got to get there. We got to get there.
And that's Governor DeWine in Dayton, just one of the stops he made on Friday, trying to get Ohioans to continue to wear their masks and stop gathering in public places to try to cut down on the number of COVID cases, which have been spiking once again. I'm Mark News. Thanks so much for joining us today on Columbus Concerns.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
Shortness of breath, patients confused, temp 102.
He just had an infection. What's going on?
He's becoming septic.
Antibiotics started. Bed ready, let's move him.
Infections can lead to a deadly chain reaction in your body called sepsis. Very quickly, sepsis can cause tissue damage, organ failure, and even death. If you know the risks, can spot the symptoms, and act fast, then you can get ahead of sepsis. Learn more at cdc.gov/sepsis.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.